welcome to the Mayor's Health Roundtable on March 31st. We'll get the show on the road and I'll ask Mayor Peary to lead us off.
Good afternoon, and once again, thanks for everybody for being on this line. As we said over and over and over again, this is the place that you get accurate information on exactly what's going on within the community from all the service agencies that are out there on the ground, boots on the ground, dealing with this. So, as you know, we had a couple of cases announced last night, and I would have to say, as expected, we're still moving through this. We are only 2 weeks into the declaration of emergency, and it's, relatively speaking, unfolding as we thought. But the other half of that, of course, is the longer that we're in this with relatively few numbers, the more stable we believe the situation is. As I reported yesterday, no active cases in TDH and or Lady Minto Hospital in Cochrane. All of this is very good news for certain. I'm in constant dialogue with the large employers in our area, talking to them about their health and safety policies, which are all very, very, very stringent, all very good, so we can feel safe about, and we can feel good about that as well. But again, first order of business is Dr. Leanne Canton from the Parkline Health Unit, and she's here today to give you an update in person. Thank you.
Good afternoon. Hello?
No, go ahead.
Hello, yeah,
Go ahead.
we're just calling in Joe Beeson.
Okay, thank you, Jill. Morning again. Hello. So I'm Dr. Leanne Canton, Medical Officer of Health for the Porcupine Health Unit. And today for our update, I will confirm that yesterday the PHU received notice of 2 new individuals who have tested positive. The female in her 60s was identified as a close contact of another case and was already following public health guidance and was in self-isolation before becoming symptomatic. Thus, there's no concern for potential exposures to anyone. She continues to do well, and we wish her well in her recovery. The 12th case is a female in her 30s who was identified again as a close contact of another case and also has links to international travel. She remains also stable in self-isolation, following public health guidance appropriately, and we wish her well. These individuals are in Timmins, and we ask for continued respect and privacy, as well as in terms of confidentiality, and we wish all a speedy recovery and thank all the cases and all the contacts of cases up until now for their immense cooperation and dedication to providing us the most important information we need for the public health investigation and follow-up, and for following the public health guidance and recommendations and continuing their own self-isolation to keep everyone else safe. At this point, or as of last night, we've had 287 tests done across the PHU. 189 have come back negative, and at this time 98 are pending. We have confirmed our 12 positive cases with 5 resolved at this point in time. I would like to give a little bit more information around the testing procedures. The Porcupine Health Unit has and continues to follow, and will continue to follow, guidance from the Ministry of Health, the Office of the Chief Medical Officer of Health of Ontario, and Public Health Ontario with respect to testing, as well as follow-up and investigation of cases and their close contacts. All of this, including assessments at assessment centers or through other healthcare providers across our system, is done with immense cooperation of the healthcare teams in all of our communities and the providers' assessments of individuals as well. The most recent update still recognizes international travel and close contact with a confirmed case as the major categories to consider testing. As we have seen locally, this still manages to be the majority of our cases across the PHU. There has been some some expanded guidelines for consideration of testing. This includes healthcare workers and staff working in healthcare facilities, residents and staff who work in long-term care homes, retirement homes, nursing home settings, hospitalized patients with respiratory symptoms, and I can assure you that we have very astute medical professionals across the district who have already been following their own clinical perception and assessments within hospital systems to guide and review testing opportunities in patients presenting to the eMERGE who have been very unwell. This also includes members of remote, isolated, rural, or Indigenous communities, as well as, again, reinforcing individuals who have traveled outside of Canada and any individuals who have been identified as a close contact of a confirmed positive case. The other important thing for all of these, there's two other important things. One is all of these groups are considered when they have symptoms. So at this point in time, we are not testing asymptomatic individuals in these categories unless there's other extenuating circumstances. For the general public, there's no indication to test anyone who is asymptomatic, and this is pretty standard across the province. The other thing is there's still required an assessment. And so at the same time, it's important to recognize the role of a clinical assessment by healthcare providers across the Porcupine Health Unit area. And as these centers open, we will expect more individuals to be assessed and more tests to be done. However, again, it's not a guarantee that absolutely everyone will be tested. And we know this is similar across the system. We will not have the capacity as a province or as Canada to test every individual going forward. I encourage people to review the online assessment tool. I actually went through it myself yesterday, and if you completed it before March 27th, it has been updated with these considerations that I just discussed. And I encourage you to complete it because it actually gives a pretty good representation of what the recommendations are. And if individuals go on and complete it and you note that your answer to your first question is yes to having a cough or a fever or shortness of breath, and you subsequently answer no to everything else, which is all of the other exposure or risk categories, the recommendations come out to self-isolate at home and stay home and protect anyone else from potentially getting unwell for 14 days. At the same time, we recognize not everybody has the capacity to complete the assessment tool. So those who can, please do. Not only can it be reassuring and informative, but it can also help guide the process when you call the Porcupine Health Unit or your primary care provider as we work through the potential assessment tool together to determine next steps for potential assessment and consideration of testing by a healthcare provider. And again, individuals who completed the tool before March 27th, I encourage you to have a look at it and repeat the tool again. We do agree and cannot deny much of the speculation that there are more cases. We have been saying this. We want individuals in each of our communities to act as though there are cases in their communities. We want everyone to assume that there's potential exposure when you're out in public. And that is why it is just so tremendously important to follow the public health measures of staying home as much as possible and all of the other things that we continue to ask and remind individuals to follow. The key is the recommendations are the same. We expect more cases, we expect more communities to be impacted, but we want to reduce this as much as possible, and we need your help. Stay home, self-isolate if unwell, and help us stop the spread. One other thing to clarify with respect to the testing. We know that time to results is increasing or has increased since the first initial tests were taken. And this is because we've seen an incredibly increase in testing across the province and across our region. And obviously the labs have been working hard to keep up to that demand. We've seen increased laboratories across Ontario develop the capacity to do this test, which was refined with Public Health Ontario Lab, and we've been very fortunate to have their assistance in this. I will be reporting today as well that the Timmins Public Health Ontario Lab will also be conducting tests and will be taking tests from the Northeastern Ontario. We can expect increasing test capacity and wait times to improve. However, at the same time, as we see increased testing across the region, that will also impact the wait times for any test results. What I can say is that any individual who is being assessed for a test or has had a test completed is advised at that point in time to remain in self-isolation for 14 days. So regardless of when the individual was tested or when the test result comes back, the public health guidance and follow-up has already begun. And we know that healthcare providers across the system are sharing this message as well. Some other recent updates, some of which may be repetitive, but I think it's important that we continue to reinforce. The Quarantine Act now mandates that any individuals with international travel must self-isolate for 14 days. Again, if you have symptoms or concerns, contact your primary care provider or the health unit, but please stay home. I've already mentioned the public health lab in Timmins is going to be doing testing for across the Northeast. We have now seen the extended provincial state of emergency for another 2 weeks, with increased call for physical distancing and people to stay home. This includes limiting any gatherings of groups greater than 5, with the exception of funerals, and that number can go up to 10. It also includes a call on looking at how the changes in weather are going to impact our physical distancing. We are seeing increased concerns about the lack of physical distancing in areas across Ontario as the spring weather arrives. And although we don't see that today, at least here in Timmins, we know we have had some of these days, and we know we'll have more to come. We really want to ensure that our entire PHU population is prepared to enjoy the nice weather, but only with their immediate family members, and not if you are in self-isolation. This is critical. For those over 70 years, the Chief Medical Officer of Health, Dr. David Williams, again reinforced the need for anyone over the age of 70 to stay home and self-isolate. And we as communities need to continue to provide the support necessary for any individual required to be in self-isolation to remain so safely and healthy. Again, I can't emphasize enough, regardless of the number of tests, the number of positives, and where they are, or where they have been, we need everyone in every PHU community to follow the public health measures. It is critical. And waiting for a positive individual to be labeled in your community or announced is too late. We are requiring mandatory self-isolation for those with international travel for 14 days. Anyone who is unwell with symptoms that are potentially related to COVID, so cough, fever, and/or shortness of breath, or other respiratory symptoms, stay home. Self-isolate for 14 days, refer to the online assessment tool, contact the Porcupine Health Unit or your primary care provider as appropriate. Anyone over the age of 70, stay home and self-isolate. Family members of those over the age of 70, please don't go visit them. We know it's hard, but it's not helping. Everyone else, stay home as much as possible. Please go out for essentials only. Don't go out to shop as a family. Limit the number of individuals that are going out. Limit the number of trips that you are taking. When you are outside of the home, practice physical distancing. This means 2 meters apart, and this is incredibly important when we look at the transmission of COVID-19. So please be mindful of this when you are out of the house at all times. The other continued warnings and precautions for infection prevention still remain critically important. Wash your hands often and well. Cough into a sleeve or a tissue. Stay home if you're unwell. Clean and sanitize commonly touched surfaces. Stay socially connected, but physically apart. I know people are concerned. I am too. We all are. And we will get through this. The health and well-being of our community members is the PHU's #1 priority. And we need your patience, your understanding, and your cooperation. This is tough, and we know that. Things are evolving, and we as public health monitor these changes with ministry guidance and the collaboration of our tremendously supportive and valued community partners across the district to ensure an appropriate response for all community members. We are in this together. Stay home and stay well. Merci, miigwech. Thank you.
Thank you, Doc.
Thank you, Dr. Catton. Now we'll turn to the Timmins and District Hospital.
Hi there, Kaylee Russell with the Timmins and District Hospital. So through the Timmins and District Hospital pandemic plan, work to build hospital capacity continues 24 hours a day, 7 days a week. This work is not solely reliant on the number of positive cases in our area, but through the collaborative consultation with local, regional, and provincial health authorities. The Timmins and District Hospital pandemic plan was implemented the moment cases of novel coronavirus began to be known. This plan is continuously updated based on accurate information to meet the ever-changing needs of COVID-19 pandemic. The hospital remains focused on ensuring that any individual requiring medical care receives the best care possible. As of this morning, and as Dr. Catton mentioned yesterday, there are no confirmed cases of COVID-19 admitted to the Timmins and District Hospital at this time. Consistent with our pandemic planning process, we have been able to double our ventilator capacity and critical care capacity and this gives us access to potentially 51 beds as of today. This is a fluid process, and the work to continue building with capacity is ongoing. We also want to take the time to thank the community for respecting the visitor restrictions currently in place at the hospital. The staff at the hospital realize that these restrictions are not easy, but they've been put in place to save lives. Following the Ministry of Health guidelines, these restrictions are vital to reducing the possible spread of COVID-19 to our patients and staff. To ensure that our patients remain connected, free phone and TV service are available in all patient rooms. Staff are available with iPads to help patients connect with family and friends through Skype and FaceTime while visitor restrictions remain in effect. While the pandemic remains at the forefront of everyone's minds, the Timmins District Hospital also continues to see patients for varying other medical conditions. The visitor restrictions that are put in place, while difficult, are to ensure that all patients in the hospital remain safe. We want to send our thanks and appreciation again to all of the dedicated frontline workers who continue to support and care for our community every single day. To ensure their safety and the safety of all of our patients and everyone else in the community, we're asking you to please continue following the directions of the Porcupine Health Unit. I know they have been said frequently, and I don't think they can be said enough, but we want you to wash your hands with soap and water for a minimum of 20 seconds, or use an alcohol-based hand sanitizer often. Avoid touching your eyes, nose, and mouth. Cough into your elbow. If you cough or sneeze into a tissue, immediately dispose of it and wash your hands. Stay home when you're sick, and practice physical distancing and stay 6 feet or 2 meters apart from people. If you do suspect you have symptoms of COVID-19, the Timmins District Hospital is urging you to call the Porcupine Health Unit. If you're ill and must visit your healthcare professional, please call ahead and tell them if you are displaying symptoms of COVID-19. And if you require immediate medical attention, please call 911 and, if able, answer the screening questions in a timely manner to allow EMS personnel and the emergency department staff to take all necessary precautions. As always, the Timmins District Hospital continues to respond to inquiries from the community. If you have any questions, you can contact our general information line at 705-267-2131, or you can email us at generalinquiries@cadh.com. Our contact information is also available online on our website at cadh.com/contact-us. We always encourage members of the public looking for additional accurate information to visit the website of the Porcupine Health Unit or the Ministry of Health. Links to these websites can also be found on our webpage. We ask everyone to stay safe, stay home unless it's absolutely essential, and please wash your hands often.
Thank you, Kaylee. Next up, we have Jennifer McLeod with the Timmins Academic Family Health Team.
Thank you, Dave. The Timmins Academic Family Health Team would like to reinforce the importance of contacting your doctor or nurse practitioner's office during the COVID-19 pandemic if you are in need of non-urgent medical care. At the Timmins Academic Family Health Team, community-based primary care services continue to be provided to patients by physicians and staff at all Timmins Academic Family Health Team clinical sites. Please call the office to arrange a telephone or in-person appointment. The Timmins Academic Family Health Team After Hours Clinic continues to operate by appointment only. Patients must call ahead to their doctor or nurse practitioner's office to make an appointment. We request that you come to your appointments alone, and of course, small children should be accompanied by one family member. The After Hours Clinic continues to be a good alternative to the emergency department for patients with non-urgent care needs. In addition, the Timmins Academic Family Health Team continues to provide appointments with specialists through the OTN telemedicine suite. This service continues to be available to both Timmins Academic Family Health Team and non-Timmins Academic Family Health Team patients. If you have an OTN appointment at our Algonquin website, please arrive on time and notify the nurse when screened if you have a cough, fever, or have been in contact with a person with a confirmed or suspected case of COVID-19. In preparation for all types of care, you will be screened. You can be assured that you will receive care regardless of how you answer the question. Knowing this critical information will allow your health team to wear appropriate personal protective equipment that protects them when they are getting within the 6-foot speed zone required for physical distancing to you. I would now like to introduce Danielle Lawrence, our Timmins Academic Family Health Team dietitian, who has an important health promotion message for our patients.
So hello, for those of you currently accessing my services, or who may benefit from accessing my services, I continue to offer phone sessions to patients referred to me by your doctor or nurse practitioner. During this time of physical isolation, there seem to be many barriers to continue to make healthy lifestyle changes. I would like to share some of the difficulties brought to my attention by my patients and to share some tips on how to overcome them. One of the difficulties that I hear most often is having fruits and vegetables that last a long period of time to prevent going to the grocery store more frequently. When you go to the grocery store, pick up fruits and vegetables that are canned, preferably in water, or frozen, which can last some time after the fresh produce has been eaten. Problematic eating mostly revolves around snacks, which seem to happen when we are bored or when we are unwinding at the end of the day. Instead of sitting in front of a screen, which is a trigger for most that it is time for a snack, I recommend trying something different. Try a new hobby you can do from home, such as building something, working on a project, crafting, meditating, or stretching. If you are still hungry, make yourself a snack instead of making repeated trips to the cupboard. If you are someone who is suffering from chronic disease, it is important that you continue lifestyle changes that have been discussed with you. Continue working with your healthcare team and continue to work towards healthy lifestyle changes that are manageable for you at this time. As the novelty of being at home wears off, it is also encouraged to maintain some sort of schedule. An important component of this is a sleep schedule. Often, nighttime snacking can be caused by boredom, but is often related to fatigue. Maintaining your routines with healthy eating, physical activity, and sleep is beneficial on numerous levels, including overall health. For those of you with children, use this as an opportunity to have your family involved in the kitchen with tasks that are age appropriate and teach them some life skills. Practice buying different fruits and veggies and use them as a learning opportunity. You can do some research to learn more about the fruits or vegetables in question, watch a video on how to prepare or cut the new item, and then have a taste test as a family. Hope you find these tips helpful and encouraging.
Thank you, Danielle. And finally, I would just like to extend my thanks to the many Timmins Academic Family Health Team physicians and staff who continue to work in their offices and find new and innovative ways to continue to provide care to our patients. In addition to that, many of our staff are also working at the assessment center, and which includes Danielle Lawrence, who has worked for us there as a receptionist in certainly a non-traditional role. So thank you to all, to everyone who is providing such a fabulous effort. Thanks, Dave.
Okay, thank you, Jennifer. From the municipal updates today, there will not be a report from the DSAB, nor will there be a report from the Timmins Police Service, but now I'll ask Chief Logren to provide an update.
Good afternoon, everybody. Thanks again for coming on board. Tom Loughran here, and I'm going to do something a little bit different today versus what we've done in the past, and I could talk a little bit about all the different tables and all the time that people are putting into this, but I'm going to put out a different message that I'm hoping will be picked up in my role as emergency manager. So I think the one thing that people have to realize about this emergency, this is one that we have never seen before. We've had forest fires, we've had floods, we've had others, SARS and that, but this is completely different. This is attacking the entire world, and it starts with everyone, and that's the key here. From our personal hand hygiene, the way we behave, the way we socially distance, what this looks like going forward is entirely dependent on you. I'll do my part, will you? Thank you very much.
Thank you, Chief Loughran. I have a bit of an update from Parks and Recreation at the City of Timmins. As I'm sure you're all aware, Yesterday, our Premier announced new emergency orders under the Emergency Management and Civil Protection Act. The order closes all outdoor recreational amenities such as sports fields and playgrounds effective immediately, and this was based on the advice of Dr. David Williams, Ontario's Chief Medical Officer of Health. According to the news release and the information we've received to date, the new order closes all communal or shared public, private, outdoor recreational amenities in Ontario. These include playgrounds, sports fields, courts, off-leash dog parks, beaches, picnic areas, community gardens, park shelters, outdoor exercise equipment, gardens, and other outdoor recreational amenities that I might not have collected in that previous list. Green spaces in parks, trails, ravines, and conservation areas that aren't closed are to remain open to people to walk through, but people must maintain a distance of 2 meters apart. So from the City of Timmins point of view, what we're doing right now, and we've been working on this already leading up to today, is getting an inventory of park areas and other park amenities and different groups that we work with in terms of park service, and we'll be moving towards closing all of those park areas off. Much of them are covered in snow right now anyhow, but making sure that they are closed off in compliance with that order. And that would, you'll see further communications from the City of Timmins over the next couple of days in that respect. Now that takes us through our updates, and that would give us an opportunity for some media questions, except Dr. Catton has an additional message to add.
I'm so sorry, Dave. I know you've probably all heard enough of me by now, but I think this is going to be a long time. This is more of a marathon than a sprint, although it feels like a sprint right now for all of our communities. I forgot to mention the COVID-19 assessment centers, and I just wanted to flag that the Timmins COVID-19 Assessment Center continues to work well. Individuals are asked to do the online assessment tool if they can, or call their primary care provider and or the public or the Porcupine Health Unit to go through an assessment and determine if they should be referred for an appointment. And I'd like to announce that Iroquois Falls and Cochrane, through the tremendous support with the Mix group and the work that they've put forward, are announcing today the opening of their COVID-19 assessment centers. And we've been working with that group, and they've shown tremendous leadership, and there will be announcements out later today with respect to that and the details, and we will share that as a health unit as well. Process is still very similar. We're asking individuals to consider reviewing the online assessment tool if they're able to, and contact the health unit or their primary care provider for referral for an appointment at any assessment center, and more to come for other communities. Thank you.
All right, thank you, Doctor.
Before we go to the media, Joel Beeson here. Just a couple of things very quickly. Yesterday I asked people, and people have taken us on their offer of contacting us if they need assistance, either from the municipal sector, health sector, business sector, whatever. I just want to let people know that has been very well taken up. I will just leave it at that. And there's been some progress made in a number of files that were brought to us on that. I want to thank the Chief Medical Officer of Health, who has acted quite quickly on some of the issues that I wanted to raise with her on behalf of constituents, and just want to remind people that the stellar work that people are doing across their community, from public health to people working in the grocery stores, etc. People are pulling their weight, doing what they have to do. I want to echo what Chief Tom Logren just had to say. I won't repeat it, but I think that's a point well made. The only other thing, two things that I just want to flag. We're working with the government, trying to get them to provide assistance to top up salaries of the lowest paid workers within the system, especially like PSWs. A number of our agencies are having problems, and a number of nursing homes, et cetera, are having trouble trying to maintain the staffing necessary to be able to deal with things. And part of the issue is that the wage of PSW and others is being a factor. So we've brought that to the government, and we're working at trying to find at least some sort of temporary resolve to this issue for now, and hopefully in the longer term we can get to it. The last thing I would say is, as you know, the legislature, there's going to be a small group of us returning on the 14th of April in order to extend more than likely the emergency measures powers that the province has, because the way the legislation is written, they can enact that on their own, but they need an act of the legislature to extend it. And that's why they're going to be going. But just also know, there's also other legislation that we're dealing with that I, as the opposition health leader, am dealing with the government health leader and our critics and ministers and others in order to deal with some of the legislation that's going to be needed to deal with some of those things. And more with that later as the information becomes available.
Okay, so.
Dave, it's John. Can I get 20 seconds?
Oh, sorry, John. That's Chief Gauthier, and my apologies. I thought there wasn't a report today. Go ahead.
Yeah, originally there wasn't, Dave, but I kind of changed my mind. So, following the declaration of a provincial emergency on March 17th, 2020, several emergency orders have been made under the Emergency Management and Civil Protection Act to contain the spread of COVID-19. The community needs to understand that this is a serious matter relating to the health and safety of all of our citizens. We are strongly urging everyone to do their part in preventing the spread of COVID-19 and reminding citizens that failing to comply with emergency order is an offense that can carry serious consequences. I will leave it at that for today.
Okay, thank you, Chief. Now, questions from the media?
It's Bob at FM. Dr. Catton, do you have any more details at all on the assessment centers in Cochrane or Iroquois Falls, or will that come from Nick?
Hi Bob, thanks for the question. I can tell you that in Cochrane it's opening tomorrow. It is by appointment only, but the mix is providing the information. I think as we speak it should be going out, and we will make sure that we share that through all our channels as well at the PHU.
And we'll talk about it tomorrow on the air too. Thank you.
Cameron from the Chamber. I just had one question. I had a member reach out to the potential to manufacture Class 1 PPE, and we're exploring the channels of obviously acquiring medical device establishment license. My question would be, is there a need for Class 1 PPE in Timmins, and to whom should I direct this business owner? They've been trying to reach out, and understandably, just haven't heard a response back yet.
It's Tom Lochran here. You could reach out to me, Cameron, and at the same time, the big urgency right now is N95 masks, surgical masks, and gowns.
Yeah, thanks, Tom. He also has the capability of making gowns and curtains should that pop up hospital or something like that.
Yeah, you can reach out to me.
Thanks, Tom.
Okay, thank you. Any other questions from the media?
I just have a question for Dr. Pat. I know you mentioned earlier that the community is to assume that there is a community spread of COVID-19 and that we presume that there are more cases that are currently being reported. But I'm wondering how important it is for the health unit to provide as accurate a number as possible for how many cases are in the community, and really how much is it in the ability of the health unit to do that?
I'm sorry, who is this speaking?
It's Sergio from CTV.
Hi Sergio. So I think I'm not quite understanding the end of your question. So I think across the system we are definitely advising all communities across Ontario to assume the potential exposure and risk for COVID-19 and to take the steps and precautions necessary. And that's why we see all levels of government, all public health, healthcare partners, other providers stepping up and supporting these measures, which remain incredibly important. I think at this point in time, the numbers that we've provided based on the testing are accurate. Those are the numbers that we're reporting. What we're saying is we recognize that there are still, I think 98 tests pending today, plus the ones that were done today. And so we expect, similar to other communities across the province, that these numbers will increase. And we want that to increase as little as possible. And so we'll continue with testing as per the guidance and the protocols, and we will continue reporting the information as appropriate. But in the meantime, the most important thing is that we also have all community members' support in following the public health measures that are so critical at this time. Thank you.
All right, thank you, Doctor. Any other questions from the media?
Hey, Dave, it's Maya. I just have another just perfect basic question for Dr. Tatton. You mentioned that the Timmins lab is going to be doing the test. When will that start?
Hi Maya, thanks. It's already started, so they have begun. Again, I just need to clarify because I'm concerned that individuals will think they can go to a lab to get tested. The labs are still, the laboratory itself is doing the testing, but they are not conducting the tests themselves. So they are running the tests in order to give us public health and all our healthcare providers across the district results, and actually across the Northeast. So they are increasing capacity for the Northeast overall and the province as a whole. So they have already begun to do this, which is great news for our area for sure, because although we see the number of tests increasing and the demand for testing is also going to increase with this, we are at least decreasing the transportation time for our area. Thank you.
Okay, thank you, Doctor. In the interest of time, we'll need to wrap up now, and I'll ask Mayor Peary to offer his closing comments.
Yes, I won't be long with my closing comments. Just again to say thank you very much for all the people that are working this every single day. I also want to reiterate what we talked about yesterday and reinforce the fact that everybody out there knows that the Porcupine Health Unit is the largest health unit in Ontario geographically. They've got their hands full up and down the Highway 11 corridor and right through and up north into the coastal communities. So they're very, very busy, and I thank them for all the time they're taking to communicate all the important information about COVID-19. There's certainly a fear in the community. On the way into work this morning, I was talked to a couple of times about these being fearful times, and yes, they are. Yes, they are. But you don't need to be fretful. You don't need to be frantic, and you don't need to panic. Let's put things into perspective a wee bit. That this has been in the communities since for largely a month. If you remember, the first case was reported in Sudbury March 7th. Now, that came from PDAC, where there was 25,000 people, a large number of them here from the Timmins area. So we're March 30th. We're March 30th. So obviously all the precautions that people were taking since that time are correct, and they're the right things to do. Only you are responsible for your own personal health. You have the highest vested interest, the greatest vested interest in protecting yourself, and you have the highest, the greatest vested interest in protecting your family. These procedures, maintaining 6 feet apart, maintaining that distance, and wash your hands. And now, don't congregate in groups less than 5. These are solid things we can do that are simple enough for us all to follow. If we follow them, we'll get through this. Thank you very much for your help.